Hello everyone, it's Hannah from HLP Therapy. We're going to be looking at some simple scar massage techniques. Now, I'd only advise these techniques if you have been properly assessed by a scar therapist, potentially a scar therapist that has trained with HLP Therapy as well. So before you start any scar massage, start to lightly engage that lovely sweeping over your tummy and over your scar. And you can do this from the first week onwards. Light touch, engaging with that scar over the top. No pressure at all, and just light treatment over and over and over the scar like so. If you've got a really nice cream or oil you want to use on your scar, something that smells really nice, then do. And if you have maybe that slight diastasis recti, you might want to sweep both your hands in towards the middle, really gently working over the tummy and the scar area. You might want to do some lovely deep breaths, putting both your hands over the scar, but really nice to start to engage with that scar in this light, gentle way. Make sure that you're relaxed, you're lying down, you're nice and comfortable, possibly a pillow under your legs, possibly a pillow under your head, something that's going to just give you that real sense of comfort and relaxation. And then when you're ready, and as long as you're over that 6-week mark, there's no infection, there's no stitches left, there's no opening in the wounds, you're happy to stitch your scar, then you can lightly start to sweep your fingers forward and back over your scar, really super gently like so. We then want to start to do that pinning and pulling over the scar. So holding one end, pulling with the other, holding behind the finger, pulling, holding behind the finger, pulling, holding behind the finger, pulling. You might want to use the pads of your index finger really nice and lightly as you're going across. Be careful if you've got longer or false nails. Make sure that they don't interact with the scar, you don't catch the scar. You're using the pads of your fingers. We recommend Naki oil, skin optimizing and repair oil, and Alhydran to start working within that scar like so. And then once you've done that nice slide and glide, you might want to do some circles. Now this is really important. The pads of your finger, set your index finger and the third finger, and you want to start away from the scar, round your hips, because of those deep fascial connections. So round your hips, mobilizing around the hips and coming into the scar, over the scar like so, over the scar like so, all the way to the other side and back again. Circling round those hips, round that scar, and then coming all the way back out. It might be that directly touching your scar is a bit tricky, so you're going to be massaging in circles above the scar like so, underneath the scar like so, and then over the scar as the last time. And you might want to do this for just 5 minutes a day. Then if your scar feels a little bit tight, what you might want to do is move your fingers up and down over your scar like so. It might be that you want to brace above and below your scar and then move your fingers up and down. Move your fingers up and down like so. And all the way coming back like so. You might want to use one finger or 2 fingers, moving up and down. Then what you can do is use one finger and do zigzag motions over the scar, and then coming back with one finger up and over the scar like so. Be careful that if your scar is really tight and pinned in, you don't want to be pulling, rolling, moving that scar if it's really pinned in and tight. But what you can do is get both fingers and just gently lift the tissues underneath the scar, like so. And then above the scar, like so. And then over the scar, like so. You might feel that pulling into the pelvic floor and hip region, and that's okay, just be gentle. You might find like some warmth here, a hot water bottle that's nice and warming on your skin or under your scar after that 6-week mark after your C-section, just to relax this area. But of course, see a women's health physio or pelvic health specialist if you have any pelvic floor concerns. So just to recap, we've done the sweeping. We've done that pinning and pulling. We've done the circles above, below and over. We've done zigzag up and down the scar. And we've done pulling underneath the scar, above the scar and directly over the scar. We hope that you found these massage techniques really helpful, and we wish you all the best in your C-section recovery.